and Denise Bergeaume for inviting us to participate in this important event. The National Organization for Tardive Dyskinesia will soon begin our 4th year, raising awareness, educating, and advocating for the now estimated 600,000 U.S. citizens with some form of tardive dyskinesia. Even though we are based on the west coast of Florida in the Tampa Bay area, we often hear from people across the globe who are dealing with this often debilitating and often permanent involuntary movement disorder. We are happy to provide patient resources such as TD support groups, which are held online on Zoom, and tools such as our TD Symptom Tracker smartphone app. And you can find both of those at tdhelp.org, our homepage. We also see as one of our primary missions the education of patients, caregivers, healthcare providers, and the public about TD. We hope to provide insights that you won't find anywhere else. As for my story, I have tardive dyskinesia from long-term high-dose use of Seroquel for insomnia. After being diagnosed, I joined a couple Facebook groups of those with TD. I soon learned that there was no national organization dedicated solely for those with TD. I was very surprised. So soon after, I felt called to start one. I began the process of forming a 501c3 nonprofit charity. And during that time, my brother was also diagnosed with TD from risperidol. I experienced some of the worst withdrawals imaginable as I tried to taper off my TD causation medication. It actually drove me to self-publish my story titled Catastrophic Withdrawal, but that's another story for another day. For today, we have put together what we hope is a deep dive into everything you need to know about TD if you're taking an antipsychotic medication. And if you already have TD, we're sure that you'll take something away from this presentation that will hopefully help you better manage this difficult disorder. As Denise mentioned, we have also invited 2 TD warriors to bravely share their real-world journey with TD and how it has affected their lives. So without further ado, I'm happy to introduce to you our Senior Director, Bill Cody, who will be providing this in-depth presentation. If you have questions, please hold them until the Q&A session at the end of this Lunch and Learn. Thank you again for joining us.
Thanks, Kathleen. It's a real pleasure to be with everyone today. If you're taking an antipsychotic or know someone who is, over the next hour, we'll help you understand what you need to know about tardive dyskinesia. So let me share my screen real quick, start my PowerPoint. Bear with me one moment. Here we go. And okay. So what is TD? Tardive dyskinesia, or TD as it's more commonly referred to, is an involuntary movement disorder caused by certain prescription medications, especially antipsychotics and anti-nausea drugs. The name tardive dyskinesia means late arriving abnormal movement. In fact, it generally takes about 3 months or more for involuntary movements to start after you've begun taking a medicine such as an antipsychotic. However, in some cases, in some cases it can take many years for any unusual movements to show up. However, if you're in a high-risk category, such as you're a senior over 50 or 55, you can start exhibiting movements as early as 1 month or even less after starting your medicine. Common TD movements include what we call orofacial movements, which are facial grimacing, rubbing the lips together, pursing the lips, clenching of the jaw, unusual tongue movements, rapid eye blinking, movement of your fingers and toes, and rocking of your body, all involuntarily happening without you meaning to do them. Some forms of TD can be very severe, especially if they affect respiratory muscles or esophageal muscles, where it can make breathing or swallowing very difficult. TD can have a dramatic impact on your quality of life. It can affect your sleep, your career pursuits, personal relationships, dating, social life, hobbies and interests, emotional outlook. You can imagine, I mean, if you are having difficulty and you're making unusual movements with especially your face or other parts of your body, people will be a little it's something you're going to be cognizant of. And so just over 75% of people with TD surveyed said the disorder has a severe impact on their physical, psychological, and social well-being. Even a mild case of TD can make you feel as if the world is aware of every movement you make. Almost half of those with TD surveyed said they were often or always stared at or asked, "What is wrong? Why are you moving?" Almost 54% of those surveyed often or always felt sad or unhappy because of their TD. And even a large percent said that TD even actually prevented them from leaving the house during the previous week. So TD makes it challenging to take care of what would otherwise be simple tasks for people, such as eating, drinking, or swallowing. You might develop sores in the mouth, teeth grinding or dental issues, mouth noises, lip smacking, tongue clicking. You may have problems speaking, or you may involuntarily actually grunt. And difficulty gripping objects, for example, a zipper, buttons, silverware, cup, toothbrush. They can all be difficult to actually keep a hold on. You may change, it may make changes in your handwriting or difficulty typing. And you may have difficulty walking or experience a loss of balance. So what causes this? This is a medication-induced illness. This is caused by medication, prescription medication, most likely antipsychotics. And in the first generation of antipsychotics that were introduced in the 50s, they were developed solely to treat people with schizophrenia for their psychotic illness and symptoms. They worked very well at controlling psychotic symptoms, the delusions, the auditory, the visual hallucinations that come along with schizophrenia, the very difficult disorder. But after a time, doctors started to notice that a large portion of those using these antipsychotics, the first generation, were exhibiting these unusual movements, which we now know as TD. In fact, the prevalence of TD in those taking these first-generation antipsychotics, such as Haldol, Thorazine, prochlorperazine, flufenazine, it's estimated at about 30% of patients actually develop TD over time of taking these drugs. And you can imagine how tragic it was to get diagnosed with an uncontrollable, often permanent movement disorder on top of the diagnosis of schizophrenia. Now, why does this happen? What is causing TD? What happens with these medicines that makes it cause this? Well, antipsychotics work because they reduce the activity of the neurotransmitter dopamine. They do this by blocking dopamine receptors in your brain, specifically the D2 receptors that affect locomotion, sleep, attention, memory, and learning. It's theorized that this can cause TD because your body reacts to this blockade of dopamine receptors by actually creating additional D2 receptors or making the unblocked receptors hypersensitive to the dopamine in your brain. And hypersensitive D2 receptors in the brain's nigrostriatal dopamine pathway, which is a pathway that contains about 80% of the dopamine in your brain and stimulates movement, cause the unusual movements associated with TD. So I know that's a little technical, but so we're trying to kind of do a nice real world and technical kind of explanation. Hopefully it's kind of layman speak also. So in the 1990s, a new type of antipsychotic, which you're probably more familiar with, was introduced to hopefully reduce side effects, especially the sky-high incidence of TD. These, what they called atypical antipsychotics, didn't just affect the D2 receptors of the dopamine receptors. They also blocked a serotonin receptor called 5-HT2. And in addition, they spent less time. The blockade of these D2 receptors was more transient. It would come and go. It wasn't a permanent sort of blockade of about 60 or 70% of these receptors. So some examples of these atypical or second generation antipsychotics are probably things that you know or maybe even have taken before. Risperidone, olanzapine, which was brand name Zyprexa, Latuda, Vraylar, Seroquel. Another one is Abilify, which actually blocks or stimulates D2 receptors as needed. It's a little more unique than the others. What happened is, what they found is that for most people taking these drugs, they did in fact dramatically reduce the incidence of TD. A meta-analysis that analyzed 55 different studies of almost 20,000 people taking these drugs found that there was a mean incidence of only 3% taking these newer atypical antipsychotics, a dramatic reduction versus the first generation antipsychotics. However, for certain populations, such as older adults and the elderly, the situation is much more dire. It still is. Studies of older adults, especially over 55, who take these atypical antipsychotics, the incidence of TD can climb up to about 24%, very commonly. So let's see here, next slide. So what are these atypical antipsychotics prescribed for? Well, they were originally also wanted to be primarily prescribed for schizophrenia, but they kind of became so popular with psychiatrists that the type of disorders that they chose to treat with them increased dramatically. In a 2020 study, it was found that only 1 of 10 people prescribed with antipsychotics had a schizophrenia diagnosis. So right now it's being treated in addition to schizophrenia, schizoaffective disorder. These atypical antipsychotics are treating bipolar disorder, depression, PTSD, behavioral issues such as aggression and irritability, borderline personality disorder, eating disorders, autism, even insomnia, as Kathleen has experienced in her own life. So while the rate of TD decreased percentage-wise, the amount of TD has increased dramatically since these new antipsychotics are being prescribed for a much larger pool of patients. Experts talk about these antipsychotics are being prescribed about, I think, 5 million prescriptions for antipsychotics, I think, per year in the US. I don't know exactly how that equates to how many people that is, but that's prescriptions. And experts now estimate that there are now 600,000 people in the US alone who have some form of TD, although an estimated 120,000 people are officially diagnosed with it. So there's a lot of folks who may be exhibiting mild or moderate TD, and they haven't been screened, or they don't even realize that it is TD. So screening is obviously something we're trying to, as we raise awareness of TD, encourage more and more frequent screening, especially if you're taking these drugs. So now going back to the typical antipsychotics for a moment, they do and have been shown in studies to damage the brain. And when you take an atypical or a typical antipsychotic, the first generation, this chronic blockade of dopamine receptors causes a lot of oxidation and inflammation in the brain. They also found that it reduced the brain's antioxidant defenses, the SOD or superoxide dismutase, which is one of the main antioxidant defenses for your neurological system. Catalase and glutathione are also in that group. Now, the good news is that if you are on a typical antipsychotic, you can reduce the chances of you getting TD by taking certain antioxidants along with your typical antioxidant that have been shown to reduce the damage to the brain's neurons. So it's not like you are just stuck with, there's a 30% chance. In fact, what they found, and this is mostly with studies of rodents and animals, however, it pretty well, reveals a similar experience, is that a particular antipsychotic, probably pretty well known to everybody, named resveratrol, was very effective at helping detoxify and get rid of these free radicals that were damaging the brain's neurons. The brains of the animals in the studies were shown to develop substantial oxidation with the atypical or with the typical antipsychotic. And in fact, postmortem examinations of brains of people with TD have revealed structural changes, including the loss of neurons with these typical antipsychotics. The rodents that they studied, taking these antipsychotics actually reduced the incidence of TD quite dramatically, from about 70% down to 30%. Now, so it reduced inflammation in your brain. It protects against damage from free radicals that are produced when these antipsychotics are taken. And let's see here. And also another journal article that is germane to this was published back in the 80s by in the Journal of Orthomolecular Psychiatry, and they found that in a busy state mental health clinic in New York, they would routinely give their patients antioxidants in addition to typical antipsychotics. These were fairly basic antioxidants: vitamin C, niacin, pyridoxine HCl, which is a precursor of vitamin B6, and vitamin E. And they experienced almost no TD cases at their clinic. And this was a very busy clinic with with about 10,000 people that they studied. So typical antipsychotics, you can protect your brain through use of certain antioxidants. So it's something very important to know. And it's unfortunate that a lot more psychiatrists aren't aware of this. Now, the atypical antipsychotics that are more popular these days, studies have found that they don't cause this brain oxidation, likely because the D2 receptors are not as the blockade isn't as consistent, and it was really this dopamine turnover that was creating these free radicals. But they have been shown to cause similar side effects as typical antipsychotics. So it causes TD to a much lesser degree, still causes weight gain, insulin resistance that could lead to diabetes type 2, cardiac abnormalities, sexual side effects, akathisia, which is just a really difficult disorder, really horrific, honestly, for anybody who has experienced it. It can also throw your gut microbiome off balance. Some studies are starting to look at that could play a part in imbalancing your neurotransmitters, which include GABA, glutamate, serotonin, and dopamine. And you frequently have difficulty withdrawing from these medicines once you start, which is difficult, because one of the things is getting off of a causation medicine that you found is making movement disorders might be very difficult and have to be a very slow process that you really must be done under the care of a physician. So risk factors for TD, who's at the most risk? I mean, obviously, if you chronically or long-term people who take long-term antipsychotics, you're at the most risk. But in addition, if you're an older adult over 50, if you're female, especially most postmenopausal, non-white, Asian or African descent especially, if a member of your immediate family has TD, because there's a big genetic component to TD that we'll talk about in a little bit. Having a behavioral health condition such as bipolar, schizoaffective disorder, if you've experienced traumatic brain injury before, if you had diabetes or if you have diabetes or HIV, a history of alcohol or substance abuse, especially stimulants, if you're a smoker, if you've experienced early onset, what we call extrapyramidal symptoms, EPS, which such as dystonia, pseudo-Parkinsonism, and akathisia, which are related but other movement disorders. If you've taken lithium in the past or an anti-Parkinsonian agent, or if you have PKU, phenylketonuria, sorry. These are all risk factors that make you possibly more predisposed to developing TD. Now, the genetics of TD are quite interesting. Researchers have found that there's a greater risk of TD if you are what's called an abnormal metabolizer of a liver enzyme that's produced by the gene CYP2D6. This is in the popular CYP or cytochrome 450 family. But new research has come out that's basically found that if you're a poor metabolizer or an ultra rapid metabolizer for these medicines, you're at more risk of TD. Almost all antipsychotic drugs are metabolized in the liver by these enzymes that are produced by this gene. So it's a very important thing. Recent studies show that, like I said, the ultra rapid and the poor metabolizers may both be at an elevated risk for developing TD. And to put this into context, up to 20% of the population are poor metabolizers. They have 2 inactive alleles for this gene. And up to 10% of the population are ultra rapid metabolizers who have more than 2 functional copies of the CYP2D6 gene. Interestingly, different genetic or different ethnic groups tend to exhibit different rates of metabolism with this gene. For instance, they found that 25% of people from Ethiopia are ultra rapid metabolizers, while only 2% of the Caucasian population is. So it would be wise for doctors to determine the status of a patient's CYP2D6 or 2D6 gene activity prior to prescribing an antipsychotic, which they may take for a long period of time. There are several genetic tests out there that are commercially available that provide this information. One thing to note is that there are inhibitors of CYP2D6 that you will want to be careful of as well. These include SSRIs such as Paxil and Prozac, and believe it or not, some supplements that are commonly taken, such as milk thistle, golden seal, kava kava, echinacea, and supplements. I think there's a fat reduction supplement called sesamin that I'd never heard of before, and also the popular antioxidant curcumin. These can all inhibit the activity of this gene, making you an even slower metabolizer. Not a big deal if you're in about the 70% of people who have normal rates of metabolizing, but if you're in a poor metabolizing situation, definitely want to be careful of that. So there are, in addition to that one gene, there are other genes that they're studying that if you have variants of these genes, likely predispose you to TD. They're listed on this screen: DPP6, DRD2, I won't name them all and put you through that, but they've all been shown to have a very strong correlation with people who have TD. So luckily, these ones often affect the functioning of specific receptors. So they theorize that they likely don't have as much impact on your predisposition to TD. But like I said, they're studying these, and right now, to our knowledge, a genetic test that incorporates all these genes that are likely to predispose people to TD has yet to be developed or commercialized. I mean, to put it into context, everyone generally has about an average of 2,100 genetic variations. So there's tons of them out there. But these variations in these are starting to look like they put you in a higher risk category for TD. And one final note regarding genetics: there's an emerging area of research called epigenetics. You may have heard of it. and it examines the processes that control the expression of our genes, especially as we age. So this may provide insights into why older people have such elevated levels of TD, because it's thought that epigenetic changes that are influenced by stress, lifestyle, nutrition, that happen as we age influence the expression of our genes, and that can contribute to the development of neurodegenerative disorders such as Alzheimer's disease. So that may be true of TD as well. So if you're taking an antipsychotic, what do you watch out for if as far as any involuntary movements that could signal you're having possibly a situation that's tardive dyskinesia? Well, be on look out for mild to severe twitching, strange movements of the tongue you can't control. If you're rubbing together your lips without intending to do it, if your face and lips start grimacing, or your eyes start blinking fast, if you have shaking or jerking in the hands, feet, or torso, you start exhibiting unusual tapping of the fingers or toes. And also there's a pain side of this. Some people experience a burning pain in their mouth. You'd want to ask your spouse or caregiver, anyone who sees you a lot, to stay vigilant for any unusual movements that you may be involuntarily exhibiting. So getting screened is something that we recommend, especially if you're in a high-risk category. I believe the general recommended screening frequency, we feel, is not quite frequent enough. Generally, people get screened about every 6 months or a year. If you're at high risk, you should really get screened at every visit. If you're taking an antipsychotic of either the typical or atypical variety. If you're at lower risk, you can get screened every 6 months. And then the screening process is generally conducted by a movement, something called the AIMS, which is an abnormal involuntary movement scale assessment. It really only takes about 10 minutes for a doctor to conduct one of these. A lot of times, since doctors usually only have about 20 minutes to spend with a patient, they may be a little reticent to go ahead and spend half their time doing an AIMS examination. But your doctor can conduct an adequate overall screening during your appointment by focusing on just the number 8 of the AIMS exam, which provides a global rating for the absence or presence of TD. They only need to spend a few seconds examining each primary body part, your head, face, neck, upper extremities, trunk, and lower extremities, and then they assign a rating from 0 to 4, which correlates to the level of TD. 0 is normal, 4 would be severe. Now, if you notice that you're making unusual movements, don't stop taking your medications without consulting your doctor. It's very important. You should, if you are going to withdraw, or that's something that's going to need to happen, these withdrawals typically have to be done over a long period of time for psychiatric medications. Everyone's different in that regard. It probably goes back to genetics, but some people get off of the medications within a few months, no problem. Other people, it takes years, and they have to taper extremely slowly without setting off these very difficult withdrawal symptoms, which can be very serious. So what are the treatments out there for TD? There are 2 FDA-approved treatments. They're called VMAT2 inhibitors. You probably have heard of them. One is named Ingrezza, and the other is Austedo. That's the brand name for valbenazine and deutetrabenazine. And these basically, in a nutshell, keep the dopamine from reaching those hypersensitive receptors. They keep them on the presynaptic side as opposed to what's called the postsynaptic side. So You've got these hypersensitive receptors, it sort of sequesters them, so it doesn't reach them. And these medicines work well for quite a large percentage of patients. For instance, Ingrezza patients, 57% of patients taking Ingrezza at 80 milligrams a day had about a greater than 3-point improvement in their AIM score in 3 weeks. An average reduction of 39% of their TD symptoms with Ingrezza at the highest dose at 48 weeks. However, there are some side effects to be aware of. 15% of those participating in the 48-week study discontinued due to a treatment emergent adverse event. The most common ones with Ingrezza are let me just find dry mouth, somnolence, fatigue, and sedation occurred in about 10% of people. Dry mouth, constipation, disturbance in attention, falls, dizziness, balance disorder happened 4% of the time. Akathisia did happen 2.7% of the time, so that's something to be aware of. So, and it also can cause a heart problem called QT prolongation. So there, and also. It does interact with the CPYP2D6 gene. People who are known to be poor metabolizers would want to have a dose reduction of Ingrezza. So that would be something you'd need to talk to your doctor about. Austedo, they finished recently published a 3-year study of the effectiveness and safety of it. 60% of patients achieve greater than 50% improvement in their AIM scores. Common side effects included anxiety, depression, somnolence, decreased weight, urinary tract infection, and most of the side effects happen within the first 6 weeks after starting the medication. However, 12% of their patients withdrew from the 3-year study because they did experience adverse events. So let's see, I'm running out of time a little bit. I want to be conservative. Other treatment options, and you can find these on tdhelp.org/treatments for full explanations of these. Many people who don't have like a moderate or severe form of TD, or if they just want to try something more holistic before they jump into the VMAT2 world, which is totally understandable, have found success with these treatment options that have been studied. Branched chain amino acids, which actually help reduce the amount of the precursors to dopamine in your brain. Vitamin E and C are effective as working together to make sure vitamin E doesn't become toxic. Ginkgo biloba, there's an interesting Japanese herbal component or compound called yigan-san. Grapeseed extract has been found to reduce movements in people who have TD. It's a powerful antioxidant. And then finally, there is something called deep brain stimulation, which can be very effective, but it's not appropriate for everyone and is usually used for people with the most severe symptoms. Of course, want to bear in mind that I'm not a medical professional, and before you incorporate any of these treatments, please consult your physician. So TD triggers, I'll go through these real quick. Anything that can boost your dopamine, which a lot of people don't know, these things can boost dopamine, can trigger TD symptoms. So if you have TD, these are things you want to avoid or watch out for. To avoid aspartame, which is found in a lot of diet and sugar-free foods. Reduce or eliminate caffeinated drinks, coffee and soda. Be careful with tyrosine, especially in energy drinks. All these are dopamine increasers. Of course, don't miss a dose of your medication, especially if you're trying to wean off of it. Reduce stress, get enough sleep, meditate if you can. And there are some supplements that people have reported getting quite a bit of help from a particular form of magnesium called magnesium L-threonate, melatonin, omega-3s, especially DHA. And so now I'd like to turn it over to Monica Gallagher from Oregon. She has TD and would just like to share her experience with it. Let me go ahead and stop sharing my screen and turn it over to Monica. Thanks so much. is Monica, you're muted.
Yep, I just asked you to unmute.
Thanks.
Am I unmuted?
You're good
Okay,
now,
great.
yes.
I'm from Washington State. My name is Monica. My journey with TD began in 2017. I was prescribed Abilify. Within a few months, I started having symptoms in my mouth with my tongue pressing up against the back of my teeth here. Over and over, it would move. It would make me real nauseous also. And then I get real weak. And I couldn't figure out what was going on with me, but I knew something was wrong. And then my mouth began to burn constantly. I never could get rid of the burning. I was then diagnosed with tardive dyskinesia. I didn't know what that was. And my neurologist put me on Austedo. Unfortunately, I didn't get the good effects of Austedo. I got a good case of akathisia, and I had to get off of that immediately. It changed my TD from mostly in my mouth to all over my body at that point. I have dyskinesia as a movement from head to toe. It affects my swallowing. It affects my breathing. It affects my speech. It affects my daily life, standing, walking. I run better than I walk, believe it or not. I started running to treat my TD because my options at this point are limited. And yoga as well. I do a lot of yoga. But walking, I need a cane. I get very dizzy. I misstep. I walk strange. My movements are very different now. So everything I do is different than it used to be. Like my body is not my own. With this illness, it has changed everything in my life. But the good news is, because I don't have to reduce my stress levels, I finally take care of myself, and I never did that before. So I try to look on the positive side because my family needs me, I need me, and I'm in this world for a reason. I don't want anybody to feel sorry for me. I try daily to be strong, but it's hard. Currently, my journey, I'm going to be seeing another neurologist. I'd also like to bring up the pain with TD. It's very extreme. It's electrical, it's stabbing, and I get it head to toe as well. And that happened after I took Austedo. Thank you so much for listening to me, and have a very, very blessed day, everyone.
Thank you, Monica. Now I'd like to introduce to you April Kraft. She's joining us from Texas, and she's going to share a little bit about her TD journey and her real world experience living every day with TD. So I'll hand it over to you, April. Thank you.
Apologies. I forgot to unmute. Thank you, Kathleen. I started experiencing some disturbances in my lower back and legs in April of 2020 at the height of COVID, and also during my father's last days. He was dying of lung cancer. I just attributed it to the stress of the moment. But as months went on, I noticed while I was at the grocery store reading the label of an item, I don't remember what it was, I noticed that my hips were basically moving opposite directions of each other. And it happened when I would focus on something, such as reading. I felt very kind of fortunate that we were under a mask mandate and that I was not under scrutiny of other people's eyes. It later became, to my sister's attention, who's an occupational therapist, who basically had a drop of training in her clinical training many decades back about tardive dyskinesia. She asked if any of my medications would cause TD. I had no idea, I'd never heard of it before. Did a quick Google search, and of course, one of my medications in my regimen, which was oxcarbazepine, also known as triliptal, could be a causation drug. I'll just kind of skip ahead because there are many things that transpired in the next months, but I was not able to see a neurologist until my birthday of April 20th, 2021. I saw a very tenured doctor at the Movement Disorder Center at the UT Health Science and received my official diagnosis. But I have also, like Monica, experienced incredible interruption in my life. I have not worked since February of 2021. I have effectively been unemployed for a year. I am fighting for my financial life. I have been blessed with my sister, who has been able to take care of my most important financial needs with healthcare and medication, keeping me in my car, so that I have the means to get to where I need to be. And also the love and care of friends whom I'm living with until I can win my battle financially, along with, taking care of the TD. So it has affected my career, my financial stability, my personal relationships. My family and I were estranged for quite a few months. I'm completely estranged from my daughter, who is my only child. I have not even considered dating. I'm recently single, and the only thing I can focus on is myself and my health. I don't want to be involved because of that. There's also, as Bill mentioned in one of the slides, there's sexual dysfunction. I do experience that, which, very personal note, that is something I never thought I'd experience in my life. But it does affect everything. The way you walk, your physical stability. My technology that I wear every day has determined that I'm a fall risk within the next 12 months. I'm like, well, I kind of knew that. I do let my providers know I'm a fall risk. So if you want me to be seated in a wheelchair, I'm happy to do that. I was part of a roller derby team before developing TD. I love to roller skate. I wouldn't dare do that at this time. So I do experience the movements and symptoms from head to toe, oral facial. I have involuntary movements in my neck that cause popping of my neck, particularly on the right side, which is very painful. If I overexert myself, which I usually don't let myself do anymore, I have electrical shooting pain that occurs in my back. There are unexplained muscle cramping, And, you know, the same things that Monica has explained. We've both experienced that. But really, it does, it affects everything in a person's life, and has certainly mine. I may have gone over my time, so.
That's okay. Well, thank you, April, so much for sharing your journey and your everyday life experience with TD. I believe it's time to turn it over to the question and answer. Is that right, Denise?
It is, yes. So this has been a very great, robust presentation. So we only have a few minutes, but there are some questions in the chat. One of them is, number one, Bill and Kathleen, can you share these slides with me so I can share them out to the attendees that are on today? I know people are asking about that.
Absolutely. Yeah, absolutely. And we actually have more slides that we didn't get to. So, you know, we'd be happy to share all of it with you so that people can be aware of some other aspects of TD.
Great. Thank you, Kathleen. Another question is, which antioxidants did you say worked best, Bill?
Well, the one that's been studied the most, there's a couple of them. Resveratrol is very effective as a neuroprotective agent. There are some safety considerations, I believe, that have to do with if you're taking blood thinners, you might want it there. If you go to our, once again, if you go to our treatments page, I believe we touch on that. The other one that's been studied is something called, I don't know if it's called Quercetin or Quercetin. That's a popular antioxidant. Another one that actually not only may protect your brain, it hasn't been studied as much, but a lot of anecdotal evidence that grapeseed extract, a very powerful antioxidant, it not only protects the brain, but may actually even help with some of the movements, reduce some of the movements. We don't know really, I don't think, I haven't found a good dosing, like what's a safe dose of grapeseed extract. So that'd be something I definitely want to talk to some sort of, you know, nutritional type doctor who knows about that kind of thing. So those three things come to mind. Of course, the vitamins E and vitamin C regimen has been quite studied at if you have TD at actually helping to reduce your movements. They work synergistically together. Don't just take vitamin E, but also add C in. And again, go ahead and go to the treatments page on our website to get information about recommended upper levels of doses that you can safely take. Okay.
Wonderful. Another question from Sandy is humming a symptom of TD?
I can speak to that. Yes, Sandy, it can be a symptom, along with grunting, almost making like a sort of like an animal sounds. There's, yeah, many of these like vocal tics, they call them, are connected to TD. And, you know, my own experience with my brother, he is autistic. But so initially we thought his grunting sounds were from the autism, but now that he's on one of the VMAT2 inhibitors, he is no longer makes those sounds. So yes, humming can play a part. I did want to say, Denise, would you like, what I can do is have everybody send me their questions to K.A. Shea, and that's KASHEA @tdhelp.org, and I'll be happy to put together all the questions and answer them the best that I can. I know Bill had a couple things he wanted to talk about for Hope on the Horizon. I don't know if we have time for that.
Probably. I don't know.
Yeah, we are kind of running out of time, but Bill, I mean, if everybody wants to maybe just stay on for about another 2 or 3 minutes, I'm sure we can get to that. So Bill, go ahead.
Okay, well, yeah, I didn't want to leave everything on a really bleak note for anybody who is taking an antipsychotic. There is some hope on the horizon, as I put. There's a new antipsychotic that's in phase 3 FDA trials that is really promising. It doesn't affect dopamine receptors at all, so it may not cause any TD. It's currently in phase 3 trials. It works on a different receptor that I don't think is fairly new, that they just discovered. It's called TAAR1, TAAR1. So it looks very promising right now, especially the side effect profile is like much better than any other antipsychotic out there. It's of course, it's not FDA approved yet. What they're really looking is to see, well, yeah, okay, the side effects are really low as far as we can tell, but is it as effective or efficacious as the other antipsychotics that are available? But a hopeful sign nonetheless. And I would say also with precision medicine and the genetic component, really, the more we learn about genetics, I think we'll be able to get to these predispositions a little bit better and determine, and hopefully based on your specific genomic characteristics, have your doctor do some tests, and some simple ones are available, as I mentioned. But to really determine it before you start taking these medicines, if you have a profound disposition genetically. So precision medicine is making some strides in that area. I guess the last thing, I don't know, Kathleen, if you want to mention a little bit about the resources we have on our site, I can go through that real quick.
Go ahead, Bill. Yeah, I mentioned, of course, the TD symptom tracker app.
Yeah, so one of the things that is very valuable, if you'd like, we have Zoom TD support groups that anybody can sign up for. We offer them 3 times a week on, there's a Wednesday daytime, Friday evening, and Saturday evening that are very helpful for people, sharing tips and their experiences. So if you want, you can sign up for these free online support groups through Zoom. They meet every 2 weeks. We've really gotten some great feedback from them. So you can sign up on our resources page, tdhelp.org. You can also view educational webinars and videos, locate a movement disorder specialist, and access additional TD resources at tdhelp.org. So and finally, if you'd like to help us continue our mission of raising awareness, education, patient support, and advocacy, we'd also appreciate anything that you could donate at tdhelp.org to keep us continuing doing what we're doing.
Great. And again, I am sharing my screen. So again, there is a tdhelp.org. If anybody has any questions, wants to reach out to learn more, please reach out to tdhelp.org for more resources. And again, I just want to thank everybody for joining us today, especially Nami National, who provided grant resources so we can host this event. And speaking of events, because it is Mental Health Awareness Week, we do want to remind everybody that NAMI does have our NAMI Walks Our Way event this Saturday. Registration's at 8. The walk begins at 9. It's going to be at St. Pete College in Clearwater. If you want to come, spend the morning with us, walk for mental health awareness. And then also we have some great classes coming up. We have a class called NAMI Basics. And again, to find out more about everything that NAMI does, you can visit our website at nami-pinellas.org. And if you want more information about NAMI, you can also get in contact with us. We have our office line, our helpline, give us a shout out, check us out on our social media at NAMI Pinellas, or again, visit our website at nami-pinellas.org. We do want to thank everyone again for joining us today. Thank you so much, Bill and Kathleen, and our wonderful speakers, April and Monica, for sharing your story. We know sometimes that when you do share your story, it can bring up some triggers. So thank you so much for being brave and courageous in sharing your story. Thank you, everyone, for joining us today. We will definitely get these slides sent out to you. And also, because this is being recorded, we will have this on our Nami Pinellas YouTube channel. So with that, I think we need to end because we are going a little bit over our time. But again, thank you so much for joining us today. Everybody have a wonderful and safe week. And